Today, I'm going to be talking about the biomechanics of the knee during the movement of running. When looking at the biomechanics of running, one must look at the gait cycle. The start of the gait cycle is when one foot makes contact with the ground and finishes with that same foot making contact. This cycle repeats itself, leading to the movement. There are two main phases in the gait cycle: the stance phase and the swing phase. At the start of the gait cycle is the stance phase, which is initiated when the heel makes contact with the ground. This is when the leg bears the weight of the body and usually the cause of most injuries associated with running. Once the foot leaves the ground, the swing phase begins. This phase is not as controlled as the stance phase. Both phases work together, so when one leg is in stance phase, the other is in swing phase. Typically, the stance phase makes up 40% of the gait cycle, while the swing phase makes up 60%. The image shows a runner going through the gait cycle. Each phase is usually divided into 3 separate phases. During initial contact, the heel hits the ground, absorbing the force caused by gravity. Then, during mid-stance, the weight of the body passes right over the leg. This is the moment where the flexion angle of the knee is the highest. The last part of the stance phase is the takeoff. This allows the body to spring off the ground. During this part of the phase, the knee is fully extended, allowing the body to release any energy that was absorbed during the initial contact. Once the toe leaves the ground, the stance phase has ended. At the start of the swing phase is the initial swing, where the knee drives up to its maximum height. This leads into the mid-phase, when the knee has reached the maximum height. The terminal end of the swing occurs when the knee extends, preparing to make the initial contact again, thus ending the cycle. When comparing the movements of walking and running, there is a key difference in each of their gait cycles. Looking at the chart, you can tell that the running gait cycle includes a float phase, where the walking does not. The float phase occurs in between the stance and swing phases. This short phase is when no extremity of the body is touching the ground, thus where the name float comes from. While there are many joints involved with the movement of running, I will be looking at the knee joint and the muscle activity associated with it. The knee joint is a synovial hinge joint, mainly allowing for flexion and extension. This joint is formed by the articulation of 4 bones: the patella, the femur, the tibia, and the fibula. Marks on these bones serve as attachment points for muscles of the knee joint. There are 4 main ligaments in the knee joint that connect the bones together. The cruciate ligaments connect to the femur and tibia. There is one on the anterior side and one on the posterior side of the knee joint. One prominent feature of these ligaments is that they cross over each other. The collateral ligaments are 2 bands that help stabilize the knee. The medial collateral attaches to the femur and tibia, while the lateral collateral attaches to the femur and fibula. In between the femur and tibia are 2 shock absorbers called menisci. There are also multiple fluid-filled sacs called bursas that help the knee move smoothly. Next, we will be seeing how all the muscles work together to allow a person to run. Like stated before, there are 2 movements associated with the knee joint while one is running: extension, which is produced by the quadriceps, and flexion, which is produced by the hamstrings. The quadriceps include the rectus femoris, vastus intermedius, vastus lateralis, and vastus medialis. The hamstrings include the semitendinosus, semimembrosus, and biceps femoris. These 4 muscles play an important role in the stabilization of the patella and the knee joint during the gait cycle. When one is running, the hamstrings act as an antagonist to the quadriceps in the deceleration of knee extension. There are numerous tendons of the knee that connect the bones to various muscles. An essential function of these tendons is their spring-like properties. This allows for force to be transported from the muscles to the bones so that we can move our limbs. During the stance phase of the gait cycle, the quadriceps perform eccentric muscle activity, acting as shock absorbers. They absorb the weight of the body as it hits the ground due to gravity pulling on the leg. The quadriceps also help keep the knee controlled and straight. The hamstrings become active during the mid-stance, working to prevent the knee from overextending and opposing the action of the quadriceps. Power is generated by the quadriceps as they perform concentric movements, springing the leg off the ground. During the swing phase, there is more emphasis on controlling the knee. At the beginning of the swing phase, the quadriceps perform eccentric muscle activity to prevent the knee from excessive flexion. At the end of the swing phase, the hamstrings perform eccentric muscle activity to prevent the knee from hyperextending. Again, the quadriceps will activate at the terminal end of the swing phase to ensure that the heel will make contact with the ground. The figure on the left shows the flexion and extension of the knee during the gait cycle. During the initial contact, there was much extension until the knee prepares for the swing phase. Then, the knee flexes until it reaches its maximum height, driving the knee up to the chest. Once at this height, the knee extends, allowing the force of gravity to be greater than the force produced by the muscles. This then causes the knee to descend. If the knee were not to extend, there would be no support for the body. The body would then continue to accelerate forward without the support of the leg, stopping it from falling over. In summary, this cycle repeats itself over and over again, as knee flexors and extensors work together to support and move the leg as it resists gravity. Since the knee joint has to support the weight of the body as gravity pulls down on it, it can be seen as one of the strongest joints in the human body. Movement of this joint is an essential part of our everyday lives as a human being. Without the coordination of all these various muscle groups, humans would not be able to run at all or even move. So, the next time you're sprinting for that top 10 number for one of the famous Gonzaga basketball games, stop and think for a moment. Think about all the bones, muscles, tendons, and ligaments working together to move your leg. Thank your knee joint for doing this in the most effective and efficient way.